All right. I hope you enjoyed the first lecture, okay, which we're reviewing mechanism of action of non-steroidals, especially the aspirin, okay, and its activity in preventing inflammation, also as a blood thinner, and we reviewed its mechanism, pharmacokinetics, and some of the new format. Okay. All right. So this is the second patient we're going to discuss. Okay. All right. So this one is item number 2. So the patient is a 25-year-old female who comes in with a chief complaint of, I have a hole in my tooth. And this patient, medical history, she's healthy. She does not take any medications. Okay. However, you do an exam and you find that she's extremely anxious, hyperventilating uncontrollably. All right. So you ask yourself, this patient is hyperventilating. So what is the initial effects? Okay. What initial effect does hyperventilation, okay, what does have on the patient partial pressure of carbon dioxide and blood pH? Okay, so we know the normal partial pressure of carbon dioxide is around 40, okay, plus or minus 5. Okay, all right. So, and then the blood pH, the physiologic pH, okay, at normal homeostasis is 7.4. That's the normal pH. Okay, anything below that is going to be, of course, it's plus or minus 0.5. So anything below 7.35, it's going to be acidosis. Anything above 7.45, it's going to be alkalosis. Okay, so what is the initial effects of hyperventilating? Okay, why don't you want your patient to hyperventilate? What's the problem with hyperventilation, right? So that's what you ask yourself. Okay, why don't you just let the patient continue hyperventilating, right? All right. So you try to ask to tell the patient, okay, stop hyperventilating, or you're gonna help them to stop hyperventilating. Okay. And so why do you want to stop them from hyperventilating? What can hyperventilation cause? Does it cause respiratory acidosis? Does it cause respiratory alkalosis? Does it cause metabolic acidosis or metabolic alkalosis? Now, hyperventilation, okay, it's a breathing issue. So the initial, now you have to understand the question is the initial effects, because hyperventilation also has late effects. So you have to understand the initial effect is mostly respiratory, okay? So the gases are going to be imbalanced. So hyperventilation, you breathe out more carbon dioxide. You're blowing out more carbon dioxide. So you're eliminating carbon dioxide from your body, all right? So when you do that, then you end up having less carbon dioxide and more of oxygen. So you get respiratory. So we know we're dealing with respiratory. It's going to be respiratory alkalosis. All right. So our answer here is the initial effects, all right, on hyperventilation. Okay, the initial effects of hyperventilation is respiratory alkalosis. Okay. All right. So let's see some of the rationale here. Okay, which we've already discussed. We're going to discuss further. All right. So you have to understand, as I explained, when you're hyperventilating, you're blowing out more carbon dioxide. Okay, and retaining more of oxygen. All right. So you have in respiratory alkalosis, you have less carbon dioxide, and the equation that you need to be familiar with, okay, is the Henderson-Hasselbalch equation. All right. Now, in respiratory alkalosis, because you're blowing out more of the carbon dioxide, and you know when the carbon dioxide is dissolved in blood or aqueous solution, it becomes more an acidic. Okay, so the pH, if the carbon dioxide is less in blood, the pH actually goes up. All right, that's why it's called alkalosis. All right, so the pH, the formula for pH is pH equals to pKa plus the log of the base, okay, log of the base over divided by the acid. All right, make sure you memorize the Henderson-Hasselbalch equation, knowing that the pH sometimes they can change to pKa. Okay, so if they change to pKa, all right, so pKa equals pH minus, all right, minus the log of base over the acid. All right, make sure you understand the equation they give you. All right, so play around with this equation. So make sure that you know the equation when they are calculating for pH equals the pKa plus log of the concentration of the base over the concentration of the acid. Okay, and the pKa equals, so when you memorize the formula for pH, don't just memorize it just for the pH, also memorize for the pKa. So pKa equals pH minus, now it's a minus, it's not a plus, okay, log of concentration of the base, okay, over acid. Of course, the acid is sometimes represented as a proton, okay, like they can do H plus, or it can be, and the bicarb is represented as, the base is represented as, okay, like this. All right, so make sure that you understand and know the Henderson-Hasselbalch equation when you're calculating for pH and we're calculating for pKa. In these exams, they're not necessarily going to ask you to calculate the specifics, but just make sure you know what's going on. All right. Now, carbon dioxide is an acid. Okay, when it is dissolved in aqueous solution or blood, and it becomes a bicarbonate. Okay, bicarbonate, which is a base. All right, and the pKa for the carbonic acid, so pKa for carbonic acid, when the carbon dioxide dissolves in water, it's like this. So the pKa for this is 6.1. All right, so you can see that it's an acid, right? It's a weak acid. All right, so in the normal physiologic conditions, the partial pressure of carbon dioxide, as I mentioned before, is 40. So usually it's 40 plus or minus 5, right? So meaning the range, if you're in the range of 35 to 45, you are still within normal limits. And the physiologic pH is 7.4, okay? And at this physiologic pH, you can, so you have a pH here. At the physiologic pH, you have, at physiologic pH, which is 7.4, the bicarbonate concentration is 24 millimoles. Okay, so you have, and they can ask you what is the concentration of the acid. Okay, so you do have three things here. You have the pH, you have the bicarbonate, okay, and you have the pKa. So you can calculate the concentration of the acid given these other variables, okay? And carbon dioxide levels are regulated by the lungs, as you know. Now, the bicarbonate, the bicarbonate levels are regulated by the kidneys, which is the reason you have to understand the question, okay? So the question asked, what is the initial effect of hyperventilation on this patient? So the initial is respiratory alkalosis. Now, the kidneys regulate, okay? They're also going to do, to compensate, okay? And they compensate by increasing, by eliminating more of bicarbonate, okay, which is a base. So when they eliminate more of the kidneys eliminate more of the bicarbonate, then you can get a metabolic acidosis. All right. So you have to understand when the patient comes in and they're hyperventilating. If they continue hyperventilating for a while, then it can cause some serious imbalances. Okay. All right. So the hyperventilation eliminates high levels of carbon dioxide. It increases the pH. Okay. And so it leads to respiratory alkalosis. Okay. And the immediate effect. Okay. Immediately, how you stop the patient from losing too much of carbon dioxide is you give them a paper bag. Okay. Somebody is hyperventilating in your clinic, you can give them a paper bag or any kind of bag really, so they can breathe in and out. All right. In the bag, if they're breathing in, of course, when they're breathing in, hyperventilating, they're breathing in the bag, they also have to cover both the mouth and the nose so that they can breathe back the carbon dioxide. All right, to increase the carbon dioxide in lungs. All right. The other way, if you don't have a bag, just ask the patient to breathe, okay, to put the hands together like they are asking for something, all right, and let them cover the nose, all right, and the mouth, and continue breathing, all right. All right. If they hyperventilate too much, actually they may also pass out. So that's why you don't want your patient to hyperventilate. You need to, the immediate thing you need to do, you need to calm the patient down, okay. So assurance. That's patient management. Make sure you go in, we're discussing biochemistry, but also since this is integrated, okay, you have to also, it comes to patient management. Your patient is hyperventilating. If you don't stop the hyperventilation, the patient can pass out, okay? Passing out meaning they can faint, all right? So usually, patients who hyperventilate, they want to sit up, okay? They want to sit up, so make sure that you put them in the correct position. They shouldn't sit up all the way up, okay? Just make sure that they're laying down a little bit, okay? Usually about 30 degrees or 45 degrees, and then let them breathe through a paper bag, or just make sure something they can breathe through so they can increase the carbon dioxide. So very important, and it is very important that you assure the patient that everything's going to be okay, and make sure that your staff don't start panicking. So the patient cannot panic, and you panic also. It does not make sense, okay? All right. So one of you has to stay calm. The ability to stay calm is the key to a very good healthcare provider, all right? All right. So now, look at this. 3 days later, okay, 3 days later, if the hyperventilation has not resolved, the kidneys will provide metabolic acidosis by increasing secretion. Okay, so they'll start producing or absorbing, they'll start absorbing more. The kidneys will start absorbing more of the protons and and um, and excrete the carbon dioxide. Actually, this is supposed to be, 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 this is suppos All right. So you start reabsorbing the bicarbonates. Okay. So the kidneys will respond with metabolic acidosis. All right. All right. Now we have the same 25-year-old patient. So now the question is, most of the carbon dioxide in blood is combined as what? All right. So the most of the carbon dioxide in blood is combined as the bicarbonate. Okay. So you may be tempted to say this one, but if this is true, this is going to be true also, right? But the bicarbonate is because when you form when the carbon dioxide in blood, it dissolves in blood. All right, this is not stable. This is a weak acid. So what happens is it dissociates into protons plus bicarbonate. Okay, so it dissociates. So most of it is going to be in this form. All right. So the rationale is carbon dioxide is hydrated. Okay, when dissolves in blood, and it forms the carbonic acid. Okay. Uh, Now it's unstable, so it dissociates to this one, which is more stable. So most of it is going to be found in this form. All right. All right. So here is um, the nephron of the kidney. All right. So we can appreciate here the cortex. All right. Adrenal cortex. I mean the renal cortex. Okay. And you have the outer portion of the medulla of the kidneys and the inner portion of the medulla of the kidneys. Okay. Now, you can see that as blood passes through the glomerulus, okay, you have certain electrolytes being absorbed, okay, being absorbed by the being absorbed by the kidneys, okay, and the body. All right. So whatever is going to stay inside the tubule here, okay, is going to be eliminated, all right, through here. All right. So when you have hyperventilation, okay, then you're going to you're going to lose the carbon dioxide. Okay, you're losing carbon dioxide, so you need more carbon dioxide. How do now we say that most of the carbon dioxide in blood is in the form of bicarbonate. Okay, so what happens is, because you're hyperventilating and you have respiratory alkalosis, now you need some of the carbon dioxide back into the body. So into the body, I mean. So the kidneys, what they are going to do is they are going to, so this is this is the body. Okay, this is the body. So this is in the body. So these protons, all right, they are going to be absorbed into the tubules here and then excreted. Okay, so they're going to be excreted, and the bicarbonate here, which are supposed to be excreted, now they're going to be absorbed by the body, so they go back into the body. Remember, this is the body. Okay. All right. So whatever stays in the lumen here, in the tubule here, is going to be eliminated. All right. So 3 days later, because when you hyperventilate, Now I'm reiterating this point. When you hyperventilate, you release more of carbon dioxide, so you cause respiratory alkalosis. If the hyperventilation continues after about 3 days, the kidneys will start they will start absorbing, okay, more of the bicarbonate back into the body, because most of the carbon dioxide, you need carbon dioxide, okay, so, and most of the carbon dioxide in the body is retained in as a form of bicarbonate, okay. So you're going to get metabolic acidosis, all right. That's compensated. All right. And this is another rationale, okay, in terms of why do you have more of the bicarbonate. Okay, so most of the carbon dioxide is found in the form of bicarbonate, okay, and that's because you also, as I mentioned, you have the carbonic acid. This acid here is very weak acid, but also you have carbonic anhydrase, okay, so Ca is carbonic anhydrase enzyme, and it's found in the cells, okay, of the proximal tubers, proximal tuber cells, okay, and this is one of them here, carbonic anhydrase, and this carbonic anhydrase is going to convert the carbonic acid here and break it down to water and carbon dioxide, okay, and this carbon dioxide again goes inside the cell, and within the cell again the anhydrase is going to be converted back to carbonic acid, and then it's going to break down to protons and bicarbs, okay, and this bicarbonate, they're going to be transported, okay, back into blood so that they can increase more of the acidity of the blood, causing metabolic acidosis, all right. Okay, so this was a quick review. This was the second case, all right. Make sure you review the first case and the second case, and be ready for the third case that we're going to discuss. Okay, all right. Good luck. Make sure there's some. Make sure you do some of the practice uh, exams, okay, that are available, so that you can increase knowledge or test your knowledge on the rest of the biochemical properties. Okay.